Celiac disease is an gastrointestinal disease, autoimmune disorder. Look at this picture, shows that normal and celiac disease damage the small intestine lining. A detail going on. Introduction. Celiac disease is a chronic autoimmune disorder primarily affecting the small intestine, triggered by the ingestion of gluten, a protein found in the wheat, barley, it leads to inflammation and damage of the small intestine's lining, hindering nutrient absorption and causing various gastrointestinal, extraintestinal symptoms. Definition. Celiac disease is defined as a systemic immunomediated disorder elicited by gluten and related proteins in the genetically predisposed individuals, characterized by variable clinical manifestations, gluten dependent enteropathy, and specific antibodies. Types. 1. Clinical celiac disease presents with gastrointestinal symptoms like diarrhea, abdominal pain, and malabsorption. 2. Non-classical celiac disease, extraintestinal symptoms such as anemia, osteoporosis, and neurological issues dominate. 3. Silent celiac disease, asymptomatic but with positive serology and intestinal damage. 4. Potential celiac disease, positive serology without intestinal damage but with potential for developing the disease. Causes. 1. Genetic predisposition, HLA-DQ2 and HLA-DQ8 genes. Family history. 2. Environmental factors, gluten intake, infant feeding practices, infections. 3. Immunological factors, autoimmune response, other autoimmune disorders, individuals with other autoimmune disorders such as type 1 diabetes. 4. Other factors, gut microbiome, environmental triggers, factors such as stress, surgery, pregnancy, etc. Risk factors. 1. Genetic predisposition, presence of HLA-DQ2 and HLA-DQ8 genes. 2. Family history, first degree relatives with celiac disease. 3. Autoimmune disorders, type 1 diabetes, autoimmune thyroid disease, and other factors, Down syndrome, Turner syndrome. Complications. 1. malnutrition due to poor nutrient absorption to anemia. Iron deficiency anemia is common. 3. Osteoporosis, reduced bone density from poor calcium absorption. 4. Lactose intolerance, temporary or permanent. 5. Neurological disorders, peripheral neurological ataxia. 6. Increased cancer risk, intestinal lymphoma and other cancers. Pathophysiology, ingestion of gluten leads to an immune response in the small intestine. The immune system attacks the mucosa, leading to bilious atrophy, crypt hyperplasia, and inflammation of the lamina propria with inflammatory cells. This damage impairs nutrient absorption. Signs and symptoms. 1. Gastrointestinal, chronic diarrhea, abdominal pain, bloating, weight loss. 2. External, including fatigue, anemia, osteoporosis, skin rashes. Neurological symptoms, including headaches, peripheral neuropathy. Diagnosis. 1. Serological test. A. Anti-tissue tranquillominous antibodies. B. Anti-endomysial antibodies. C. Denominated gliadin peptide antibodies. These are the serological tests. 2. Genetic test, HLA-DQ2 plus HLA-DQ8. 3. Endoscopic biopsy, gold standard. Histological examination for bilious atrophy, cyst hyperplasia and lymphocytic infiltration. Nursing diagnosis. 1. Imbalanced nutrition less than body requirements related to malabsorption. 2. Diarrhea related to intestinal inflammation. 3. Fatigue related to anemia and malabsorption. 4. Risk for impaired skin integrity related to dermatitis and hyperpeptiformis. 5. Risk for deficient fluid volume related to chronic diarrhea. Management. 1. Dietary management, lifelong strict gluten-free diet. 2. Nutritional supplements, iron, calcium, vitamin D, B12 and other deficient nutrients. 3. Pharmacological steroids for refractory cases. 4. Regular monitoring, follow-up with serological test and symptom assessment. 5. Patient education, importance of a gluten-free diet, label reading, cross-contamination avoidance. Treatment. 1. Gluten-free diet. central to managing celiac disease. 2. Supportive therapies, treatment of complications like anemia, osteoporosis. 3. Follow-up care, regular checkups to monitor compliance and nutritional status. Psychosocial medicine. 1. Psychosocial support, counseling for dealing with chronic illness, dietary restrictions, and potential social isolation. 2. Support groups, connecting with others having celiac disease for shared experiences and support. Prevention. 1. Genetic counseling. 2. Early diagnosis and management, awareness and screening, monitoring symptoms. 3. Dietary management for at-risk individuals, gluten-free diet. 4. Regular medical follow-up, monitoring health, nutritional supplements. In conclusion, celiac disease is a manageable condition with gluten-free diet being the cornerstone of treatment. Early diagnosis and comprehensive management are vital to prevent complications and improve quality of life. Education, regular follow-up, and psychological support play a crucial role in effective management. Thank you. Have a nice day.